Okay, hi, it's your nurse. I'm here to massage your uterus.
So on my labour ward, uterine massage isn't as routine as this video makes it out to be, but yes, it is something that we do sometimes need to do. And it can feel like when someone's pushing hard on your tummy just after you've given birth, like you're being punched in the guts, just at the time when you thought you were about to get a break because you just pushed a baby out. So what happens here? Well, uterine massage is not a routine procedure that's done for every birth, at least in the UK. We consider it in specific situations, and usually it's because there's a concern about heavier than typical bleeding. So if you're bleeding heavily from your womb, from the uterus, because it's not staying firm, it's not contracted down well after your placenta's been delivered. Many births don't need this at all. But why might it be done? Well, after your placenta comes out after birth, your uterus is supposed to clamp down. That tightening, which you sometimes can feel as the after pains, is there to squeeze the blood vessels that fed the placenta. It's one of several immediate steps that we're able to take in order to control someone's bleeding, alongside using medications that are what we call uterotonics. They help that contraction, like oxytocin and some other medications that we have. So how is it done? Well, a clinician usually feels for the top of your uterus, the fundus through your abdomen, which usually sits just around your belly button after you've given birth, and they apply some firm, sustained pressure. They can give like a kneading motion to help to contract the uterus. And we can see if it's working because the uterus may become firm. But if we're really concerned, we also sometimes might put our hands in down below through the vagina, as well as applying pressure from the top. We call that bimanual compression. And we're usually reassessing continually, and we stop as soon as the uterus seems to stay contracted and the bleeding is under control. And we can move on to other treatments if we need to. So what does it feel like? Well, the honest answer is it can be quite uncomfortable, even painful, especially if it's right after labour when your abdomen feels a bit tender. If you had an epidural or a spinal anaesthetic, you might actually be aware of it less, but you are allowed to say it hurts. Let the team know and we can explain what's happening, and we can pause if it's safe to do so, and we can give you some pain relief if you need. The aim is obviously to keep you safe and get control of bleeding as quickly as possible. And if the bleeding continues despite this massage, as I say, we've got additional treatments. We sometimes might give medicine. We look for if there's any placenta or tears down below. Rarely we might need to take you around to a theatre to look and see if there's anything we need to do surgically, but you should always be told what we're doing and why. Did this happen to you after birth? What did it feel like?